Today we're highlighting Kobe, a registered nurse who helps care for patients throughout their healthcare journey.
Can you tell us a little bit about what a nurse is?
Yeah, sure. So I would say a nurse is a healthcare professional that exists within every sector of the healthcare industry. So think about any type of aspect of healthcare, whether it's inpatient, ambulatory, nursing home, long-term care. Nurses exist in those spaces and they help be the liaison necessarily from patients to physicians, and they execute the orders that physicians are placing for patients.
What does a day in the life of a nurse look like?
Yeah, so regardless of what type of setting you work in, a day typically starts off as getting report from that previous nurse's shift, understanding the health issues and conditions of the patient that you're going to be caring for that day, and then reviewing any of the orders that the physician may be placing. And then also typically accepting new patients as an admission or an assignment for that day, and then potentially, again, communicating with other health professionals such as physicians, other nurses, dietitians throughout your day as well.
Why did you choose to become a nurse?
Yeah, so I ultimately chose to become a nurse because I just found really a lot of joy in caring for other people. I was also really fascinated by just health in general and making people feel better. I felt like nursing kind of was a profession to where it didn't seem like a job typically. It was more something that I enjoyed doing every single day. And then also just being able to build relationships with people and seeing them improve in their health regarding of what they were coming in with to make them sick in the first place, but seeing them improve overall really was a morally fulfilling aspect of the role.
What is your favorite part of the job?
I would say my favorite part of nursing is that patient connection that you make. You're able to learn a lot about someone. Patients are also oftentimes in their most vulnerable spots when they're sick, especially in the hospital setting, in the acute care setting. So during that time, you learn a lot about people. They really open up and just share a lot about their life. And I think that's honestly the best part of it. And then seeing them get better and seeing them leave is also really rewarding too, knowing that you're a part of that.
What advice would you give students interested in going into healthcare?
So students that are interested in going into healthcare, I would say do anything you can to get involved now. So whether that's volunteering, either at a long-term care center, volunteering at the hospital, that's really great exposure to just getting your foot in the door at whatever institution you want to work at. And then as soon as possible, seek out different jobs in that setting as well. So you can start off working either in food service or transport, and then work your way up to being maybe like a certified nursing assistant or like a patient technician in the hospital. Doing roles like that gets you great exposure into kind of how the profession functions, and then eventually you can find yourself into nursing as well.
What is something that people are surprised to learn about your profession?
I'll say the most surprising thing people learn about the nursing profession is how patients trust us. So nursing has actually been ranked for the 25th consecutive year the most trusted profession out of all job industries. So when you step into that role, you almost have this innate sense of trust that patients place in you, regardless of how long you've known them. So you can meet someone for 5 minutes and the level of trust they instill in you is remarkable. And I think that's really surprising. And it's also what makes the job really rewarding.